The role of the nurse in health and wellness. Nurses provide health for many different individuals and groups, each with quite different health interests and health priorities and goals. Fonte in 2014 suggests that the nurse's role is to help clients assert their right to choose their own healing journey and the quality of their life and death experiences. These require specific knowledge and competencies by the nurse. To ensure a client-centered, systematic, evidence-informed approach to nursing, nurses use the nursing process, which includes the steps of assessment, diagnosis, planning, implementation, and evaluation. The nurse's role is to help the individual or group achieve mutually agreed upon health goals. The learning outcomes for this session are to identify the role of the nurse in health promotion, health maintenance, health education, illness prevention, restorative care and palliation, and also to explore types of healthcare organizations and care settings where nurses work. Describing the role of the nurse in health and healing. So first off, I want you to explore some terminology. For your first and third learning activity, these are from the course pack, I want you to define health promotion, health maintenance, health education, illness prevention, restorative care, and palliation as they're defined in your COSIER textbook. Next, I want you to define primary and secondary and tertiary prevention. Then I want you to review the levels of prevention, foci and activities in your COSIER and examine the different learning activities, the different activities for each specific level of prevention. The Nursing Act 1991 is the legislation that designates what the nursing scope of practice is. And what it says is that nursing is the promotion of health and the assessment of, the provision of, care for, and the treatment of health conditions by supportive, preventative, therapeutic, palliative, and rehabilitative means in order to attain or maintain optimal function. Remember, this is a legal description of what nurses in Ontario can do. There are a variety of healthcare settings in Ontario where nurses work. These could be public health, home care, nurse practitioner offices, specialty clinics, rehabilitation centres, and more. Please take a look at these and have a sense of what nurses would do in each of these areas. There are 4 broad categories of healthcare services. You can find more information in your COSIER on pages 143 to 146. These 4 areas include health promotion and illness prevention, illness diagnosis and treatment, rehabilitation and health restoration, and hospice, palliative, and end-of-life care. Let's take a look at each individually. Health promotion and illness prevention. Some examples of this, for example, would be teaching young adults with eating disorders and obesity how to prepare healthy foods. It might be advocating for programs that help seniors stay at home rather than be institutionalized. It might be helping smokers with smoking cessation and more. Diagnosis and treatment. Be aware nurses do not provide medical diagnosis. That is not within our scope of practice. However, we can create a nursing diagnosis which focuses on a set of symptoms or symptom that we can work with and treat. So, for example, we analyze and synthesize data to inform our decision making. Nurses use critical thinking skills to identify health problems, risks, strengths, and priorities. Nurses plan care based on prioritized problems and their nursing and medical diagnosis. They work with clients to formulate goals. They select evidence-informed nursing interventions, and they write care plans. In the third area, rehabilitation and health restoration, the focus is on restoring people with illness and/or injury to previous or the most optimal level of health and wellness possible. Most of these activities focus on restoring self-care ability. That means helping the person and encouraging the person to do things for themselves and to build those pieces in there. And so nurses will often liaise with occupational health, physiotherapy, and other professional organizations and regulated professions in order to achieve the client's health goals. Hospice, palliative, and end-of-life care. This is a very particular aspect of nursing care. It focuses on providing compassionate care to the dying. It can take place in a designated hospice, a hospital, a long-term care facility, or at home. Nurses are the major provider of both basic and specialised end-of-life care. There's a video posted on Blackboard that you can watch. Next, I want to talk briefly about nursing process. This is a tool that nurses use to help provide organised approach to care. What does the nurse do in each stage of the nursing process? So here are the 5 stages of the nursing process: assessment, nursing diagnosis, planning, implementation, and evaluation. Take a look at these in your textbook and try to write out a definition for each, an example of what the nurse might do in each of these. I've also included a concept map from your Cozier, which was on page 435, that you can take a look at to see how the nursing diagnoses, the nursing process, can be set up with a particular type of problem or client complication. There are 3 different categories of need for healthcare, and this is important to realize that most healthcare is divided into these 3 areas. These are urgent, emergent, and elective. I encourage you to look up the definitions of these in your textbook on page 145, 146. Urgent care is something that means that would be life-threatening or very harmful to the client if treatment and care was not initiated immediately. Emergent is something where typically it might be something that is discovered or of concern. It might be that their doctor may suspect the person has cancer, or we may suspect that a person has some kind of breathing difficulty, and we need to send them for further tests and diagnoses and then follow up with treatment in order for them to get the best optimal outcomes. Elective care does not mean that it is not important, but it means it's typically not life-threatening. Some typical elective types of healthcare needs are things like hip replacements and knee surgeries. So this is a summary of the role of the nurse in healthcare. I encourage you to review these aspects and complete the learning activities, both in the course pack and the textbook. Thank you.